the facts. 5 minutes. Just the facts. So this is a valvular heart disease, the Air Force approach. All based on data, right? All evidence-based. So we have about 11,000 cases of valvular regurgitation in this distribution. You can see here about a third or pulmonic, a third tricuspid, a third mitral. Aortic valve, we have the least amount. As far as trace regurgitation, the number one valve involved is tricuspid valve. When we talk about mild, the number one valve involved is mitral valve. When we talk about moderate, it happens to be the aortic valve that is the most common abnormality. So we care about progression rates. Who needs to be waived? So in the Air Force, we looked at these progression rates from mild to moderate. First, I'll say trace. You can look at any data you look at. Trace valvular regurgitation, no matter what the valve, is fine. It can be normal, it can be physiologic. So that doesn't require a waiver at all. You can fly. As far as progression from mild to moderate, AI progresses 8%. Mitral valve regurgitation was about 2%. Pulmonic and tricuspid, we just didn't have enough to make any statistical conclusions, but we believe, based on this data and other data published, that mild aortic valve regurgitation is not normal. That does require a waiver in the Air Force. We'll follow it every 3 years, and you'll talk to your flight doc. That's all we do for AI. All the other valves, any other valve, mild regurgitation is okay. So trace, all valves are fine. Mild aortic or mild regurgitation, they're all fine except for the aortic valve. We'll follow as far as moderate to severe. We did that, about a third of them progressed. Tricuspid valve and pulmonic valve, is in a whole different, we didn't see enough of them again to make a big conclusion. It was less than 1%. But what I'll say here is this is the right side of the heart is a whole different animal, and it is very much related to endurance, athleticism. We see people with moderate, even greater tricuspid valve regurgitation completely goes away with decreased exercise. There's a lot of data we want to look at that. But I will say moderate progresses. So anybody with moderate valvular disease will need a waiver in the United States Air Force. AI is one valve. If it's moderate or greater, we will not let you fly high performance for the same reasons that Ed talked about earlier. When you start pulling G's, everything pulls. If you've got something going out the aortic valve, it goes right backwards. So it's not a good idea with moderate AI to be flying high performance. But other than that, any moderate valvular disease will require an Air Force. It will require a waiver. How about bicuspid aortic valves and mitral valve prolapse? We'll talk about mitral valve prolapse first. I'm running these right now because we hadn't done this. There's not a lot done on this. We have about 229 cases. It's fairly common, and then about half of cases will progress, and this has been published before, and we do see progression rates. So any abnormal valve, mitral valve, abnormal, all these will require a waiver. We'll follow them every 3 years. You can still join the Air Force. You can still become a pilot. We're just going to follow you very closely. The progression rates on those we're running right now. Bicuspid aortic valve, very, very common. And these are the two big studies a lot of people talk about a lot. This is a Mayo Clinic study. The problem with this study is this was Mayo Clinic. Any of the cardiologists in the group here will say if you've got a bicuspid aortic valve that otherwise has nothing wrong with it, that there's no reason to be sending them to Mayo Clinics. There's a huge referral bias. They call these guys all asymptomatic, but they had different degrees of AI and aortic stenosis. The progression rates were quite high. The risk of needing surgery was 27. Most of these were in the 5th and 6th decade of life. So the question is, what about all comers? This is another study that everybody quotes that says everybody's going to end up having to get a valve sometime. 22% here. The problem with this study is this is Toronto Congenital Heart Hospital. These people could be symptomatic. They could be severely symptomatic, included all types of AI and aortic stenosis. So what about if we could find a database of about 250 patients that actually are normal, completely normal? All they have is a bicuspid aortic valve. We have that. We're running that data right now. We're going to present this at asthma. 37-year-old average age. We followed them on average 10. We had people out that we'd followed as long as 34 years. And what we found is it does progress. So 131 patients that had bicuspid aortic valve only, nothing else, no associated, no aortic insufficiency, no aortic stenosis. They progress. 86% of them progress to some amount of aortic stenosis, aortic insufficiency. Therefore, if you have a bicuspid aortic valve, you'll need a waiver in the Air Force. We'll follow you. If you want to change policy in the Air Force, because we used to not let bicuspid aortic valves fly, you have to be a congressman's kid or a general's kid, right? So they came to us. We disqualified a general with general's kid, and then we disqualified a congressman's kid. They said, tell me why bicuspid aortic valve can't fly. We did the data, we did the research, and guess what? They do progress. They progress usually 20 years down the road. They do very well if you follow them very closely. So we actually do let bicuspid aortic valves fly in the Air Force. We follow them very closely. They do require a waiver, and they will come see me. These are all the cases of bicuspid aortic valve. Again, some degree of AI is very, very common. Again, you follow these progression rates. About 20% would have aortic sclerosis. That's that calcified valve we talked about earlier. About half of those go on to actually have stenosis. So that's just everything I said. How about aortic valve replacements? We're going to talk about that right now. We're going to have a CT surgeon come talk to us. This is a patient we had that actually had came to us for his bicuspid aortic valve, and it had progressed. He was symptomatic when we saw him. This is what his root looked like. This is aortic root, very dilated. This is my artist rendition of what it looked like, and this is what he ended up having. He had a bovine valve replacement, and then they had to do some Dacron grafting up there. They came to us and he said, hey, I'm feeling great. I'm 5 years doing great. Echo is completely normal. The valve was just a beautiful valve. You couldn't even tell that it was a bioprosthetic valve. So we followed him. We looked at all the data that had been done to that point, and we said, all right, we'll give you a 2C waiver, and we'll see you back every year, make sure you're okay. But the United States Air Force is not run by doctors, it's run by the line. So the line said, we think you can fly high performance. So they actually gave him an unrestricted waiver. He was flying A-10s, and he's doing well. I'm going to see him back in September. He's 8 years out. He has a little bit of mild AI now, but he's doing well. He actually is going to pin on general here soon. So this is just what I was going to say. We do have 7 folks right now still flying after the aortic valve was replaced. All these are non-high performance. In fact, even the guy I just told you about, every year we recommend another non-high performance, and they just renew his high performance waiver. And 100% of mitral valve regurgitations have gone on to surgery. They do repairs. They do very well. I was talking to our next speaker last night, and they're getting really good at these. They're getting really good at these. And in the 20 years, in people average ages, early 20s to 40s, they do very, very well. So in conclusion, what am I at? Oh, I'm at 6 minutes. Hey. In conclusion, trace, all of them can fly. If we talk about regurgitation, mild is fine in all valves except the aortic valve. We talk about stenosis. We didn't talk about stenosis a lot. Stenosis cannot fly. They cannot come into initial pilot training if it's found later. We follow for progression rates. Anything worse than mild, we will not let fly. High performance. Mild to moderate, we watch these very closely. I don't like stenosis. Some of my worst nights in the hospital taking care of civilians was on mitral stenosis, or was on aortic stenosis. Bicuspid aortic valve, mitral valve prolapse, they do require a waiver, but we will let them fly. Screening echocardiograms, we can talk about that later. Just to say that, I know this was discussed earlier, we did do screening echocardiograms from 1994 to 2008. This was our data we published previously that they talked about earlier today. We used to not waive any of these. Mitral valve prolapse, bicuspid aortic valve, mild AI. All these were diagnoses that used to not be waiverable back in the 90s. They started getting waived as we disqualified generals and congressmen's children, and then we started letting everything be waived. So now we waive all those, such that if we take our 20,200 20,000 patients, our disqualification rate was 1.45%. We then gave them waivers. We're following them to this day, but there are only 9 of these would actually be a hard DQ. So our DQ rate was 0.0445%. We said that was not worth it. I already have to read 25,000 EKGs a year. Now I don't want to read another 10,000 echoes. So this is all the people that would have got disqualified based on those diagnoses. This is how many we actually disqualified. So the United States Air Force does not require screening echocardiography anymore. These are the processes that were found to be disqualifying, no waiver recommended. You can see moderate AI, because there's more than any moderate we don't allow. Repair tetralogy of flow, you would have found that by talking to the patient or looking at the big scar across their chest. These right here you would have heard on exam. This you wouldn't have. This was an incidental finding. So a lot of these, what we're saying is you would hear on exam. Hypertrophic cardiomyopathy was not found on any of these folks, and that's one of the big things that people worry about. So that's the truth, right? So that's the policy for the United States Air Force. So, when I moved to Dayton, Ohio a few years ago, I have a 1-acre lot. So the closest house to me is quite a ways away. 2 doors down, I'll be darned, there's a CT surgeon. The guy behind me is a CT surgeon. So I travel 15 hours, over here, get stuck in 2 different airports, take a train, and last night I sit down and guess who sits next to me? It's a CT surgeon. For crying out loud, I can't get rid of him. So we're gonna have to work together. That's what I came up with. So our next speaker will be a CT surgeon.